And joining us for this week's Your Health segment is Dr. Jonathan Packer, Assistant Professor of Orthopedics at the University of Maryland School of Medicine and Team Orthopedic Surgeon for the University of Maryland Terrapins. Doctor, thank you for being with us.
Thank you for having me.
Across all of your practice, not just team doctor, what's the most common knee injury that you see?
Probably the most common knee injury is meniscus tear or some kind of cartilage damage. But it really depends on the age of the patient. The young patients were particularly concerned about getting an ACL injury. The rates of ACL tears in high school athletes have really skyrocketed over the last 20 years.
Why would that be? What would make, I mean, knees are pretty much what they used to be, so something else must have changed.
Yes, and for the most part, they're playing the same sports. However, more kids are playing sports nowadays, and they're getting more involved playing year-round and having more exposures. So they're on the field more hours per year than they were in the past, and they're playing at a higher intensity. So those are some of the more common reasons why.
Put you on the spot for a second,
Sure.
Because the Baltimore Ravens just tore up their artificial turf field and went back to more or less natural grass. Do you think there's any connection between the artificial surfaces that even younger kids are playing in at high school stadiums and some parks and some of these injuries?
There is some evidence that there is a higher injury risk with artificial turf. However, I think there are some other factors that certainly have a much higher factor in having these young athletes get injuries.
What kind of ages are we talking about? Well, what's the youngest patient you would see show up with an ACL?
Well, you can get them in patients as early as 9 years old. The really young patients tend to go to the pediatric orthopedic specialist, but my most common age group is high school and college.
You happen to bring your knee with you, which we appreciate. Let's take a look, maybe just kind of show us what we're talking about. What's the front end there? Sure.
So I'm sure everybody hears about cartilage, meniscus, and ACL and other ligaments. So I'll just kind of show you what they are. So here's a knee model. Here in front is the kneecap, the patella. So we're peeling that off. The top here is the thigh bone, down here is the shin bone. And this blue protective layer, in this model anyway, is the cartilage. And that allows the joint to move nice and smoothly and to protect the joint. These C-shaped structures down here are the meniscus. And you can think of those as like shock absorbers or cushions. And these two ligaments on the outside here, one of them's already torn on this model, are ligaments, and this ligament right in the middle of the knee is the ACL, which helps prevent rotation and from the shin bone moving front and back too much.
All right, so how does somebody know, or does everybody know that they've damaged it? Is it readily apparent what it was?
For an ACL injury, the majority of patients will hear or feel a pop. Very quickly, usually within hours, they'll develop a large swelling in their knee, a large effusion. It's oftentimes difficult to walk. So that's what happens initially. And then over time, those symptoms will improve, and they typically don't even have any pain, but their knee will just not feel stable. And when they try to get back to cutting or changing directions really quickly with sports, their knee just doesn't feel quite right.
Let me remind our viewers, if you have a question about preventing or treating knee injuries, give us a call. We'll have the number up on the screen. You can also tweet your questions to @MPT News. Is there such thing as a partial tear?
There are. You can tear part of the ACL, and so those patients can actually do fairly well with non-operative treatment, depending on how much of a tear that you actually have. But the vast majority of tears are complete tears, and unfortunately your body does not heal it, and there's no way to get it to repair. So for a young athlete, it almost always means surgery and almost a year out from sports.
Now, for an older person who has an ACL tear, is the treatment different?
Yes and no. If it's an older, very active patient, the same principles apply. We need to restabilize the knee. So we usually recommend surgery. However, if it's an older patient that's not very active, oftentimes we can treat them with physical therapy and a brace.
So in the immediate aftermath of one of these injuries, what do you do in terms of first aid treatment?
Well, the most important thing the first couple weeks are elevation and ice. just to really get the swelling down. Typically before surgery, we have about 3 to 4 weeks of prehab, what we call it. We send them to physical therapy, try to get the swelling down, try to get the muscles to work again, and more or less try to make it look like the other knee so that their knee is ready for a surgery.
Has the surgery evolved at all?
It has. It has, in fact. Every, I would say, 5 years or so, we make advances in either the way we fix the grafts that we use, and actually about 8 years ago we changed the placement where we put the grafts. So it's actually one of the most commonly studied surgeries in sports medicine, and we continue to evolve techniques.
What's the recovery time like? You mentioned you're going to be out a year in terms of competitive sports, but in terms of just being able to walk around?
Just being able to walk around, I mean, that would also depend on if you had any other damage in the knee. But if it's just an ACL, typically within a couple weeks, patients are able to walk pretty comfortably. We let them run in about 3 months. But it really takes that graft at least 6 months to fully heal to the bone. So, and in fact, some of the research has showed it even takes up to 2 years, maybe, until it completely heals.
Let's grab a phone call. Prince George's County. This is Myra. Myra, thank you for calling. Go ahead.
Thank you. Yes, I tore my meniscus in 2 places on my left leg. I was a receptionist in a bank, and I had to put supplies away in the cupboard, and I climbed up and tore my knee, and 13 years ago, and I still cannot rely on this leg to lift me up. Like I do exercising, but what I have to do is roll over. This knee doesn't, getting out of a bath or anything like that, I cannot rely on the knee.
Myra, thank you for the phone call. Best of luck. What do you think?
Bye-bye.
There's a lot of factors. One would be her age and how much, if she has any arthritis in that knee. But certainly some rehabilitation, physical therapy to strengthen the muscles around the knee can help take some pressure off. If there's some structural damage there and she doesn't have much arthritis, she might benefit from a knee scope, if you will, to fix that.
It's interesting that the ACL issue occurs when we're talking about young athletes more commonly in girls than boys.
Absolutely.
Significant difference there, and why?
For non-contact injuries, it's 4 to 6 times higher in young women than young men. In fact, most of the ACLs that occur, it's a young athlete changing direction really quickly without anybody even hitting them. And that's because the muscles just aren't controlling the knee well enough. They're not strong enough, or the student athlete doesn't have good enough balance in that knee. So there's actually some preventative programs, and if there are any students or parents of students out there, I would go on, you can even Google ACL prevention programs. There's a lot of them out there. I can't say one's better than the other, but they work on neuromuscular control, balance, getting the core, glutes, and hamstrings stronger, and that certainly can help. And those all tend to be weaker in young women than men, so that could be one reason.
Let's squeeze in one more call.
Sure.
Prince George's County, this is Bill. Bill, thanks for calling. Go ahead.
Yeah, how are you this evening? Yeah, I've got 2 questions. I tore the patella off my left knee. I'm 64 years of age, and on the right knee, I tore the meniscus about 25 years ago. But when I tore the patella, it took me about 2 years to get my knee back without having any operations. My second question is that how come whenever you go see knee doctors, the first thing they want to do is do knee replacements?
Okay. Bill, thanks very much for the phone call. Good luck to you.
Well,
you don't do knee replacements.
Yeah, I do everything but knee replacement, so I definitely wouldn't offer you that.
Here's your doctor, Bill. Right?
Well, if you get to a certain point where nothing else is working, you have severe arthritis, certainly knee replacement's a great operation. However, if the longer we can delay that, the better.
Any connection between somebody who has one of these ligament injuries and having arthritis later in life?
Yes. Actually, if you have an ACL tear, you have a much higher risk of getting arthritis in 12 to 15 years. And for a lot of these high school athletes, we're talking about in their 30s, and that's even with the reconstruction. So there's thoughts that maybe we don't reconstruct it perfectly like we think we do, or maybe there's just some initial damage there, but certainly there's a higher risk.
Dr. Jonathan Packer, University of Maryland Medical Center, team orthopedic surgeon for the Terps, and we hope you're not busy in that capacity this football season. Doctor, thanks for coming by.
Thanks, Jeff.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.